fellowship program came about through the mental health crisis that kind of emerged in 2020. There was a shortage of providers willing to take new clients. Our wait list went from pretty much non-existent to over 100. At the same time, we saw a mass exodus of licensed providers. We saw people leaving the nonprofits throughout the state and really the nation so that they could start their own private practices. But in that process, they were taking less insurances, and they were kind of catering to the people that had the money, or they were going to places where it was harder for a lot of our clients to access the support and the services that they needed. The community really rallied around JFS Delaware and realized that in order for us to support the community needed to support us. And so the politicians and state government, local government, they came together with us on this to say, like, if this is your vision for how you serve our community, then how do we help serve you? And it was a big step for us because I think that the average timeline that it takes for someone to come out of graduate school to the point where they're licensed is a lot longer than the typical 2-year period that it can take. And so I think we're losing 2 to 3 years a person when we don't have a program like this. And that means hundreds of thousands of people that are waiting on wait lists throughout our country saying, please help me. And we have people that have the degree and the schooling to do it, but they haven't had the support to get that licensure in time. And so we need to look at this program and see how we can speed this up throughout not just Delaware, but all the country so that we serve more people.
I was living in South Korea, and I had been attempting to get employment to work on my licensure, and I was trying to do it while I was in Korea, and it wasn't possible. And I had been in communication with one of my previous professors at Wilmington University, who worked alongside with Wendell, I guess, in various internship programs with JFS. And she forwarded me the opportunity, and I jumped on it immediately, and that's history.
So ironically, I didn't know that I wanted to join. I'm used to being a case manager, and I had a conversation with some of my supervisors who saw something in me that said, therapy may be the right track for me. They encouraged me to consider being a part of the fellowship and learning more about therapeutic modalities and how to just better do what I already do for my clients. And so I got involved, and it seemed like a great opportunity.
I think that so many times in the mental health field, you cannot be supported by your agency. You're kind of left on an island of one to figure it out, and that's not at all the climate of JFS, particularly the fellowship. We are provided resources. We are able to be human and have bad days and be held with grace during those bad times. And then when those bad times are needing to be navigated, we have people on staff that really just are there to support you unconditionally. And then when you're through the other side of it, you feel so much more empowered and capable of taking on the next hard case.
The impact of the fellowship program, it's pretty big. I think that we had providers that felt kind of almost hopeless that they could graduate and get into licensure. And now they're realizing that this is a really great avenue for them to come through and not just gain licensure, but gain the skill set so they can operate independently. But I also think for an agency, we have found a lot of people that will grow into leadership positions. They'll help lead new programs, new initiatives for us. And they've helped us kind of shape our path a little bit. Some of the groups that we've launched have been groups that fellows have thought about on their own before they came in the program. We just supported them in launching those programs and making the actual partnership with the agency. But really, who benefits the most is the community. By the time we're done with this, there will be thousands of clients throughout the state of Delaware who would not have received service if it wasn't for us. And when I think about who those people are, they're families that may have been at risk of being separated from one another, their kids that may have been placed somewhere, their mothers that maybe are struggling and they were scared to ask for help. And so we are able to serve from childhood through death, like the whole population of Delaware. And there's just a lot of people there that would have missed out on these services.
I can say that I would recommend anybody of all shape, size, color, creed to be able to come here, get resources, not feel othered for who you are. It's just a great organization. Full stop.